Welcome back to the channel. Today's case is not a transplant case, it's a Phaco in a hard and difficult scenario. This patient has a uveitic cataract and posterior synechia that do not allow for adequate pupil dilation. So we have to use a device, and today we're using the Melugan pupil expansion device, and this is the first time we've ever used it. It comes preloaded. Rather, you have to preload it yourself. It comes with an injector, and you engage the pupil margin with it. And then, if you're lucky or skilled enough, you can engage 3 of the pupil margins directly while injecting, and then the last one, the fourth one, needs to be manually placed on the proximal pupil margin. And then everything is very comfortable. It's more comfortable than the iris hooks because you don't need any extra incisions, and that's great. And there's not much bleeding on the surface because the hooks require incisions to be positioned more posteriorly, and there's always bleeding from the limbal vessels. And it makes for a better video if there's not much blood. And we've switched to stereo coaxial illumination to get better contrast, but of course this is not apparent in the video because of the low light that the camera captures. But we do this routinely, and honestly we couldn't even be able to safely perform these cataracts in these poor view corneas if we hadn't if stereo coaxial illumination hadn't been available, because this sacrifices depth of perception, stereoscopy, for contrast. And stereoscopy can be mitigated through experience, but contrast cannot. So that's why these videos are always dark, but the surgical view is much better, and you feel safe while operating. And then removing the Milligan ring is simple and elegant. You just have to engage the proximal scroll and then be a bit careful with the implant itself. But if you're a patient, it retracts into the injector. And then at the end of the case, for this patient, we're also performing fine needle diathermy with the needle from a tenonylon stitch together with the unipolar cautery. And the purpose of here is to limit the amount of exudation that occurs in the corneal stroma, and maybe to limit the haze formation, and maybe to improve the the vision of the patient as well. Um, Machine settings are at their lowest, and that's the case. Thank you for watching.